Welcome. I'm Dr. Burton Miller, medical founder of the Animal Wellness Center. Animal Wellness Center is an animal care facility where we focus on preventative medicine through the use of therapeutic nutrition, puppy wellness programs, and also geriatric care. Those are the two really fundamental parts of our practice that differ from a typical veterinary practice. We have a very large puppy population. We're often referred to as the puppyiatric facility. We have puppy referral sources who have been very happy with the work we've done on their dogs and have recommended that their breeders send their new dog owners to us. Probably the most important part of our puppy care that differs from other facilities is that I've developed a number of hybrid medicines that incorporate both plant extract and pharmaceutical medical medicine combinations. While the plant extract components both increase the potency and reduce the side effects. Once breeders started to experience better success with their puppies, that was really the basis of their confidence in us to send us more and more puppies. We subsequently developed a health warranty program for puppies, where if a breeder entrusts their new owner to us, we promise that we will take care of certain diseases at no charge to the owner, diseases that we know how to handle from years of experience. And it's inevitable that some puppies get sick. And when a puppy gets sick, they can get really sick because they're very fragile young individuals with incompletely formed and functioning immune systems. The success we've had turning these cases around and reducing the incidence of killer diseases such as puppy pneumonia, which used to kill up to 25 or 30% of each litter, down to 5% or less. So the confidence that the breeders got in our program made it easy for them to send more clients, and we encourage that. By creating a program that would make the process easier for the breeder, easier for the owner, and one of the keystones to the growth of our practice. We have a training department here. We offer free evaluations, free little mini training sessions when they're here for their first visit if they have time to do that. We almost always have a trainer on site. And we have a staff of multiple trainers who are just a phone call away and will come to the owner's house to do an early intervention. puppy who's just starting to show bad behavior can be turned around in a very short period of time. Whereas a young adult dog who's well entrenched in bad behavior is a much more challenging.
When the client comes in and there's usually 5 or 6 people waiting in the waiting room, I'll come up to the people and say to them, is this your first time at the Animal Wellness Center? And if they say yes, I have them come into my office and I go over with them everything from chewing, biting, jumping. Those are the basic things, but then I'll ask them, what things that they're having as problems. If they've been told how to house train the dog, then I'll give them a session on housebreaking and animal care. I'll also explain to them that this new puppy that they took home is not their baby, but it's their dog.
So a connection between this type of training process and the presence or absence of certain disease states later in life. A dog who is trained is a dog who knows it has a leader and is not put in the position of thinking it has to be the leader of this semi-competent human pack. And a lot of these little dogs know that there's just no way that they can protect this pack. The dog often feels it has to, by default, become the leader and protector of its humans. Some breeds are built for that, like German Shepherds. But the majority of dogs that we see are cute little breeds or hybrids that have been bred for temperament, docility, submissiveness, trainability, but that's not what a pack leader does. So a dog who is not trained and is not destined genetically to be a pack leader type will often have anxiety disorders that could play itself out as like a nervous bowel or as thunder anxiety or fireworks anxiety or separation anxiety, whininess. A lot of dogs who are chewing on themselves are actually acting in an anxious manner, often miscalled as being allergic dogs.
My name is Cheryl Spruill.
And my name is Shelley Spruill.
And this is Samantha. In addition to Dr. Miller, we have just fallen in love with Donna Casey. Donna Casey trained Samantha. And it's just, she was just so consistent with everything that we found here at the Wellness Center. She treated Samantha like she was her own daughter. We fell in love with Donna, and she fell in love with Donna. Samantha was a little unruly, to say the least, when she first came. Oh heavens. But I'm telling you, Donna saw it all. Everything. I was so embarrassed. But she saw everything and said, you know, no big deal. Let's do this, this, this. Boom, boom, boom. She took control right away as soon as she came in our house. The first lesson, Samantha was obedient. I was totally shocked. Totally. And now we have a wonderful dog, and we loved her when we first got her, but we really love her and appreciate her now. The first time that we met Dr. Miller was just such a wonderful experience. He was very warm and inviting. He gave Samantha a toy like right away. She took to him right away. It was wonderful to see a very personable doctor and someone who's obviously very dedicated and loves what he does.
Right, that was important because our pets are our family members. And we don't just bring our family members anywhere. It really makes a difference that the doctor is loving and knows how to treat the pet. And when Sam came in, Dr. Miller she just took right to him and he was able to pick her up and talk to her, and she, as big as she is, and she just loved him. So we knew then that, you know, this is the place we need to be.
Yeah.
Well, we've had a few pets before, but one in particular was my dog Thunder that we got from Canine Corral as well. And we went to another vet that was closer to our home, and the vet, it's not that he didn't love Thunder, but he just treated Thunder in a way where Thunder would jump from him and twitch at times. And if a dog isn't comfortable, something's wrong. I don't like that. You know, I want to be comfortable with my doctor, and I want my pet to be comfortable with his doctor. Right. And sure enough, you know, Dr. Miller was very comforting for Sam. So that's a big difference that I noticed. Yes.
Yeah. Yeah,
right.
Definitely. There's no fear here with her at all.
Scout has been seeing Dr. Miller for the past 3 years. I adopted her when she was 2, and she already had some kidney imbalances and urinary problems, crystals and high acid levels. So he's treating her with diet and supplements and meds. And she's doing pretty good. At one point she had a back problem. She hurt herself, and he treated her with acupuncture and chiropractic, and she's running like a wild dog again. She's going to be turning 5 this coming November, and she's doing good. Well, I would say with the back it took maybe 4 treatments. And then it reoccurred sometime after that, so again maybe 4 treatments and seeing him weekly. and she was fine. Yes. Max, who was his first patient that I've had with him, this is Max. He died at shy of 15. Which was a miracle because he was born with chronic disease. I started at 5 years old with Dr. Miller, and he had had 3 other vets prior to, and with no success. He had inflammatory bowel disease and pancreatic inefficiency, and I had him since a baby. One thought it was pancreatic inefficiency, the other thought it was inflammatory bowel, the third one tested and found that he had both. And he was unstable all his life, crawling the walls in pain. And Dr. Miller finally stabilized him late in life, but thank God he was finally stabilized with a lot of tenacious efforts. You know, nothing worked overnight for him. It took diet, it took homeopathy, it took acupuncture and herbs and digestive enzymes, and we finally got him where he was stabilized. We had gone to a former holistic vet, and he never got stabilized with his treatment, and his regular vet, I didn't want to put him on the meds and the antibiotics that he wanted to put him on, and then we saw an internist who insisted on steroids, which at that point I was desperate because he was crawling the walls in pain, and I did it for about a week, and I saw his decline in terms of activity because he still was an active dog in spite of his pain, and so I stopped that. Because he was so tenacious, stabilized him. Dr. Miller didn't give up.
We are true conventional medical practitioners as well. So each one of these abilities or each one of these modalities is just one more arrow in the quiver to be pulled out and aimed at that disease when that's the right treatment. Sometimes they're used individually, and sometimes the different modalities are combined.
The best foods that I've seen are the foods that take a little bit on your part, like adding boiling water to the food, adding in the meat, make a couple of meals at a time. That's how simple it is. Different foods that Dr. Miller has picked out. His garden mix is the main mix that I've always used. Since the garden mix, I've seen him come up with another mix called a gluten-free mix for dogs that have gluten problems. Another one that he has is a grain-free mix, which for dogs that have a problem digesting grain. Doesn't seem to be that Dr. Miller feels that grain is the real biggest problem in dogs. The undigestibility of the things that go into the foods make it that the dogs get such little amount of nutrition from the dog foods that when they just switch over to the food, the people within 90 days can see the world of difference. For people that don't have any problems with their dogs, he does recommend the Holistic Health Extension by Vet's Choice, which is a pre-made food that has all the things in it that Dr. Miller recommends, but it is pre-made. So he also has very healthy vitamin mineral supplements that get tailored to your dog's needs. My name is Bill Miro. We had a miniature dachshund. His name was Sparky, a great little dog. He was a little over 13 years old at the time. Our current vet had been treating him for quite a while. He had some skin allergies and some stomach problems. He was taking heavy prescription drugs for a long time. It was the only solution that they had. And they also had warned us at the time, with taking the prescription drugs for a long time, it would affect his stomach, it would affect his liver, things like that, and we would have to monitor. He had a grossly enlarged heart also, and a bad valve. So we knew it was a problem, and it was a dead end, basically, at our other vet. So we didn't want to accept that. Nobody ever does. So we saw Dr. Miller, we liked what he had to say, we liked his attitude and everything else about him, and seemed like a great guy, knew what he was talking about, and we decided to give it a go. And as he detoxed our Sparky and gave him acupuncture and aquapuncture and chiropractic treatments, we would come away from here with him actually feeling good. He returned some spunk back in the young boy, spunk back in Sparky, and he definitely gave him some youth back. You know, it was great.
Yes, we do. The heavy drugs that, you know, that the normal vet, you know, would just prescribe because it's okay, you got this problem, take these drugs and the problem will go away, you know. The problem doesn't go away. You become dependent on drugs, whether it's prescription drugs or, you know, illegal drugs. It's not a good thing over a duration of time. So some of his ailments, like the enlarged heart, that was something that was probably always there, and then we found out there was a valve problem that was probably always there. But the stomach, the liver and pancreas, you know, problems were due to, we feel, I believe Dr. Miller also, to the drugs that were administered over, you know, regularly over quite a number of years. So. The decision had to come that, you know, we couldn't do anything more for him. Then that too, it was very different at Dr. Miller's. He made that part easier, and you know, just the whole attitude of him and his staff here, it was more family-like than clinic-like. It made you feel better. You know, it doesn't make you feel good, but it made what was, you know, like the worst thing we ever had to do a little bit better. So, you know, overall, it was a great experience coming here, and we have a new puppy now, and we couldn't wait to come in and see Dr. Miller again under better circumstances. And we would never go to anybody else. So our mind is made up. Dr. Miller's our guy.
My name is Bonnie Veron. I have 4 dogs. One is at home. It's a Springer Spaniel. We're in love with Spaniels. Bailey here is the oldest. He's 5. Sandy's a week different. He's 5 also. And Cody is 4. They're all December birthdays. Makes it very easy for me to remember. Yes, had teeth cleaned. He had a lump one time and had surgery. Yes. We use a lot of his herbal. We are using it now. Sandy has eye allergies in the fall. He's greatly improved. After he went through with the 6 months of steroids, he was starting to lose his fur. I just wasn't comfortable. I know it can't be right to be on steroids long term. And that's how we wound up here to begin with. And Dr. Miller called it right away. It was right after his one of his vaccinations for Lyme disease. He says, and he showed me all the paperwork. He said, that's how we got it. It's a common reaction. And like I said, after you start reading in the newspaper about dog foods with melamine from China and chicken treats, you start thinking, I'm not feeding that to my dog. I can do it better myself. And I think we do, you know. We came to Dr. Miller maybe about 4 years ago after Cody had a round of polyautoimmune arthritis. And I wasn't happy with the 6 months of steroid treatment and was looking for some alternative. And Dr. Miller has been very genuine about giving us information and helping us through some difficult times. We had another cocker that we lost in January with cancer, and Dr. Miller helped us through that. Lost a puppy after that, and now we have a Brittany. 4 seems to be our magic number. We do make our own dog food. We have a dehydrator and make our own treats. And I'm open to alternative medicines. We want them to live as long as we do. Mostly with their coats, since we do make our own food. Their coats have greatly improved. Their allergies have lessened. And I just feel better about giving them something that's more wholesome and organic, that I have control over what's going into their food. We bought a professional meat grinder and I shop at the restaurant Depot. Grandma won't eat at our house a hamburger because she thinks she's getting dog food. But I'm an empty nester and these are my new and better children. Oh, don't put that in, please. Put it in. It's in. Nothing can love you better than a dog. And they don't talk back. Right?